Let's get started. Let's get started here today. We have our agenda up, and you can see I'll share a little bit about NSC. I think many of you will probably already know us fairly well, so I won't go too deep into that. There's a little bit of context I'd like to share with you for why we're talking about ESG and many other topics like that from a safety perspective. And then I'll dive into our research work. So we've released an executive summary of this work this week, and I'm going to share a lot more detail about that and everything else. And finally, hopefully we'll have a little bit of time for Q&A. I do have a fair amount of content here today. Just we'll note that up front. So I'll move through this all pretty quickly as I can. So first, just a little bit about us here at National Safety Council. We're America's leading nonprofit safety advocate. You can see we've been around for 110 plus years now, since 1913. We have 13,000 member companies representing 41,000 plus work sites and millions of workers, both in the US and around the world. And our mission is really to eliminate the leading causes of preventable death and injury so that people can live their fullest lives. We do focus that work because that's a huge amount of things to take on. So we focus that work in two main areas where we think we can make a big difference in the workplace, which is our traditional space, as well as on the roadways and in transportation safety. And then the issue of impairment, which we define quite broadly, it covers everything from fatigue to substance misuse. It really cuts across those two different disciplines and domains. And when you boil that down at our core, we're about saving lives from the workplace to any place that you may find yourself. Something that I think sets NSC apart, and the reason that, even though we're constrained a little bit in those domains and those different areas, we still find ourselves with all sorts of things to do, is because we go follow the data. We look at where people are getting hurt, where they're dying, whether that's on the job or on the roads or elsewhere. And we build programs, efforts, and resources based on data analysis and rigorous research. What you can see here is an example of that's been going on since 1921, which is our Injury Facts publication, which now resides online and is updated constantly with new and great statistics and analysis. So encourage you to check that out if you haven't. But the point here is really that everything we share and everything we do is grounded in research and practice. So what I share with you today is work that has been really involved a lot of data analysis and a lot of folks who have shared what they've been doing, what they've been seeing in the field as we go. A little bit about what's under the hood in the workplace practice at NSC. We have a number of workplace programs and tools and resources which are freely available, sort of the left side of this slide. So encourage you to go to the NSC website, nsc.org, go poke around and look for some of these things, whether it's our work in the Campbell Institute, our Work to Zero program, our SAFER program, or MSC Solutions Lab. Tons of great content, resources, tools, calculators, well-being resources, everything available to you there. And then NSC also has some, for service solutions and things that we can do to help you if you want to go deeper, as well as, of course, we do a lot in the membership arena, and we advocate and seek for impact, both within governments, within local organizations, within for-profits and corporates, and all around the world. So a lot of things that we do. We're joined in this effort today in terms of this research by a great partner of ours, Lloyd's Register Foundation. I've just put up a little bit about their values here and just to demonstrate how closely their mission is aligned with ours and their vision of the world is aligned with ours. They have a rich and deep history of safety, starting in the maritime field and really now extending to many other domains and disciplines. So we're extraordinarily grateful to the Lloyd's Register Foundation for the funding for this research project, as well as just for the partnership and general sense of a direction that they bring in terms of our shared mission. So really want to take a moment to appreciate Lloyd's Register Foundation for their work. You may have also seen on the front slide that we partnered with a number of other entities on this work from a research perspective, primarily Verdantix and Valuing Impact. So a shout out to those two entities who do great work and really assisted us on the research side here in some of the things that we did across this project. So wanted to call them out as well. So that's a little bit about NSC and where we're coming from in terms of this work. I want to provide a little bit more context for why we're diving into what we're calling the new value of safety and health, because that's a pretty big topic. And you might wonder, with all the other things we have going on, why is that a strategic driver for us right now? Why is that something we're focused on? Well, obviously in the past 3 to 5 years, there's been a tremendous amount of change. And what I'm sharing here is work that came out of some of the early day things that we were doing around the COVID-19 pandemic. And, as we were looking at how work modalities were changing, the way we were doing work, what worker expectations were of the work environment, and what things were successful in enabling in getting people to work safely and keeping them safe while at work. We really started to do a lot of thinking, a lot of conversation, a lot of interviews about these topics. And everyone had to, right? We all had to change midstream in terms of how we were approaching things, doing things the same way just simply wasn't going to work for anyone anymore, for a variety of reasons. So we had hundreds of conversations, thousands of survey data points, lots of workshops and focus groups that went into this framework that we derived. And it really led us to what you see at the bottom, which are 8 trends that we believe we're headed toward the future world of work around 2020, 2021 timeframe. And in there, you see a few things that are relevant for our conversation. One of them being safety and health embedded at the core of organizations, but another being reduced footprints, enhanced sustainability, and some continued engagement with that ESG and sustainability space. Looked at a little bit more graphically, you can see this sort of infographic version of this. There's some great resources for this on the website, by the way, that you can go and grab, and a study that's associated with all this that pulls it all together for you. But just wanted to share that this was what was in 3 to 4 years ago, really pushing us forward and making us think differently about the way we talk about safety and health in 2023. And maybe put in a slightly more active way, if you take all those concepts and all those big drivers and things that are going on externally in the world, you need to boil it down to what topics and what areas and what issues are we actually going to work on as a result of all that. So you see here a version of some of the key topics in the workplace arena that NSC has been focused on in the past several years. And one of them, which I've called out in red here, and really the reason we're here today talking this morning, is the intersection of ESG and EHS. And it's not a solved issue. It's something that I think we've been studying for quite a while and trying to understand how to best position safety and health in this discussion of human capital, ESG, sustainability, and really how to bridge the gap there, because we do think there's a gap, and I'll share more about why. The goal is not to push one over the other or say one's wrong, one's right. It's really to look at how we can have a fruitful and useful conversation, speaking the same language to a degree, really trying to pull the rope in the same direction, because I think ultimately we are. So that's really the reason that we're here as a safety organization, talking about this issue of ESG and a number of other things that sit alongside of it. And of course, I'll talk a fair bit about ESG this morning, but I also want to mention that when we talk about the new value of safety and health, we're talking about all these topics that you see here, and you'll see that represented in the research work here that I'm going to share. So that's a little bit of our preamble. And again, I know I'm moving through this fairly fast, so feel free if you'd like to type in questions into that Q&A box as we go along. Happy to try to answer some of those midstream as we go. But really for the bulk of the rest of the hour here, I'm going to be sharing the next few bullet points on the new value of safety and health. So we'll take a look at some of the early work we did that led up to this. We'll talk about a landscape survey that we performed with Avetta, which we're again very thankful for Avetta's involvement in this work as well. Some of the project scope that we set out on, the models and themes that we derived, and then I think most importantly and most excitingly, we'll talk about the upcoming case study and activation guide that we have for this work that will really help you dig into the how to do this. This is not intended to be a purely academic or conceptual research report. We really went into it at the outset saying, if we don't provide people with the tools at the end of this, we're going to have really failed halfway. So that's a really critical part of this. And then of course, if we have some time for Q&A, we'll switch over to that as well. So yeah, here we go. So background and early work in the new value of safety and health. I mentioned wanting to talk a bit about ESG this morning. I think most of us have a pretty good idea. When we say the word ESG or the acronym ESG, we probably know what the acronym stands for. We might not quite have a good picture of all the different things that are underneath each letter of that acronym, though. So that's really one version of what this chart is showing, is that if you look at the ESG piece as environmental, social, and governance, what do those all mean? In the environmental space, there's lots of things there that traditional safety and health folks probably aren't going to touch much, and that's perfectly fine. Some of us may have roles that split across E and H and S, and maybe we touch some of those, or we engage in them in some places and not in others. There's a governance side, which is really more about the ethics and the way you run your business and compliance and transparency and fair practice and all those sorts of things. Again, not typically the domain of the safety and health professional, but where it comes to maybe board interaction, we see some engagement there. As well as maybe in investor relationships. But primarily where our space is really on the social side, and you can see health and safety called out really directly on this chart, so just highlight that. But in the human rights discussion, the supply chain discussion, the way in which we sort of just treat the person in our organization, all of that is really rolled into that social pillar of ESG. And as safety and health has evolved, I think we've really broken out of that box of purely just being health and safety people. And we have a lot of engagement with a lot of these topics. And that's really was a big motivator for this work, was to say, if we're going to be in these conversations, how do we demonstrate the full value that we bring and the things that we do in 2023, which are, in my view, quite different to what we were doing in 2013, 10 years back. And to that end, this is actually one of the first pieces that we published as an organization on the topic of sustainability and safety. This was around 2013, 2014 timeframe. It was tagged to an event that we held at the NSC Congress and Expo that year. And what you see here are my recollections mostly of the kind of commentary we received at the time. We did a feedback survey. I pulled some of the data directly from that. But some of this was just sort of recalling what we heard, and I think mostly folks didn't really get it at the time. They wondered why we were pushing the topic of sustainability as if it were this entirely different beast that had nothing to do with safety. And I think, to a degree that was more true in 2013 than it is now. A lot of the sustainability efforts we were seeing were led by marketing folks, maybe had the impression that they were greenwashing in nature. And of course, we've got some of that discussion in the mix now too with the ESG conversation. But we had a lot of, I'd say, pushback from the audience 10, 12 years ago on why we were engaging in this work. Well, in the meantime, a lot has happened. So, I'll try to compress 10 years of ESG and sustainability, movement in a slide or two. One of the big things that happened was a rapid rise, really massive, in the number of ESG and sustainability frameworks, schema, ratings, rankings, all sorts of other elements. And it's a fairly complex landscape, and this doesn't even cover the half of it. But the idea here is just to show that we've got this ecosystem that's grown up around us, in which we have some organizations who are providing guidance, sort of voluntary standards for how you should think about ESG, safety, and disclosures. We've got some organizations that request information from companies, aggregate it, and then rate you. We have some that pull data from all sorts of sources and then also rate you, but they don't involve you in that discussion. And then we have others who kind of buy data from some of those other folks and then extrapolate even further rankings and ratings. And maybe they ask you for data to inform their opinion, or maybe they don't. And what it's led to is just, a massive proliferation of work that we need to do in this space. And to a degree, it's commoditized the way we think about safety and health in this context, because we've been sort of pushed down into just a data point, one of many, many, many data points that live in investment ratings and rankings. And there's a lot of noise that gets hidden there. Another big thing that we've seen in that past 10 years has been a huge rise in the number of dollars that we're seeing flow into responsible investing, whether that's ESG investing, sustainable investing, beneficial company investing, people investing, whatever different flavor of that you may look at. There's been a huge uptick, and this doesn't even account for the last couple of years where that hockey stick has gone even further up. And this is just one metric. It's principles for responsible investing, dollars under management here in trillions. So, in 2020, we were reaching, nearly 100 trillion in responsible investing dollars. And that's, I think, nearly doubled by now. So we're really in a pretty big space here in terms of what the external market is asking us to do. And, as the saying goes, when my boss, cares about something, I care about it. When he's interested in it, I'm fascinated by it, so to speak. So if you think about the investment community, if they are the ones who are fascinated by this or interested in this, then we need to be fascinated by it and really deeply understand it. A last thing I'll share that's happened in the past 10, 12 years has been a huge change in our labor force and what they care about and what they think about. And as we've seen millennials and what's represented as post-millennials here, Gen Z, coming into the workforce, now represent the large majority of the workforce. And again, this is 2017 data. We had about 65% of the workforce, millennial, Gen Z. That has only increased in the past few years, although we've seen some folks come back out of retirement due to COVID. So those numbers haven't always been quite on this arc. Point here, though, is that alongside the massive proliferation of ratings and rankings, the investment community change, the workforce and what the external kind of public cares and thinks about has changed as well. And we've certainly seen that represented in many different fronts. But it's coming from within our workforce as well as from external to our workforce. So lots of change, lots of things that have led us to maybe think, hey, maybe 10 years ago, we should have leaned in at that table rather than push back from it a bit. But that's always nice hindsight. We had plenty of other things to occupy ourselves, and look at the tremendous changes we've made, in the past decade in the pure safety and health space, in, HOP and serious injury and fatality prevention and all of these other fantastic advancements. So I'll share more about that as we go on too. So not to say that the safety and health community was wrong to take the position it did. And of course, we're all different. We all probably think differently about this. But I think that the point here is that now's maybe the time to lean back into this and see how we can engage in our roles in this conversation. So where did we start in trying to understand all of that, right? If that's the landscape we're dealing with, we needed to have a bit of a better picture of, what the average safety and health person was thinking, what the average ESG person was thinking, and how we could come at this in an effective way. So NSC and Avetta, as you heard me mention earlier, really went out and tried to understand this a bit better. We focused on broad practices, what people were doing, what their baseline was, and we had almost 800 folks respond. This was largely targeted at safety and health and ESG leaders in organizations, so folks who would have good access to this information. And it gave us a good baseline to understand where our audience was, where you all are in terms of dealing with these things every day in your organizations. So you see a little bit of a breakdown of our demographics here. This was a cross-sector study, so we have good representation from a lot of different industry sectors, perhaps a little overrepresented in manufacturing and construction, just due to the folks we typically talk to. But you can see here 70% roughly of those polled as organizations. We were asking them to answer for their organizations. Do you have interest in ESG issues? Overwhelmingly, pretty large number who do. And even more organizations, when you answer those if you look at those who are interested in the issue, nearly 80% of them are committed to having a sustainability policy. So it gives them a footing to stand on, or an ESG policy that they stand on and start at. And you can see that varies a little bit by organization type. Typically, those who produce something tangible, physical, that's sold to a consumer. A lot of manufacturing organizations are driven toward greater policy here, just because they may be compelled to do so from their supply chain pressure, if they're sourcing raw materials or things of that nature. Of that group, the majority of them, so now we're down to about 300 who are interested in and have policies in this space. About 300 of those respondents got further here into the study here for us, and about 60% of those had formal ESG metrics and targets. And of that 60%, about 70% had safety and health targets. So you can kind of see now we're at about a quarter of the original survey group that has these targets. And if you look at the type of targets, I think this sounds like good news to a degree. It is. That if you look at the types of targets and metrics that are included in the reporting, there really are low-hanging fruit metrics. So the ones that we know are not necessarily representative of our actual capacity and performance in safety and health on a day-to-day basis. There are lagging indicators of performance, total recordables, fatality rates, things of that nature. In some cases, you get organizations who are reporting value creation or maybe proactive activities or leading indicators like near misses. But by and large, we're reporting the very low end safety and health metrics, which we know just from our own experience don't always play one-to-one in terms of what direction we're headed. The other, I'd say, good news, bad news finding here from the survey was that 85% of organizations in this 300 group had safety and health involvement in ESG strategy, sustainability strategy. That's awesome. But if you look at what role they're playing here, only about 15-16% of organizations in the survey of this 300 group. So again, we're looking at maybe 6% of those studied have safety and health leaders in a decision-making role in ESG strategy. Mostly safety and health folks are playing execution, guidance roles, maybe partnership roles, support roles. But by and large, we're doing the things that are being set as strategy by the organization. We're not influencing the strategy the organization takes. So, big gap there in terms of where we could and should be showing up. I did see a question about the recording. Yes, you definitely will be sent a recording of this, just so anybody is listening may wonder. We will get this all out to folks at the end of the meeting for sure. So a little bit of a good news, bad news situation there, but I would say that, at the end of the day, we do have material things to bring to the table that are relevant to this discussion. So, here are 5 of them. I think we can all probably see ourselves in these 5 things, right? We're a big stakeholder in, if we're calling it human capital or social activity, safety and health has a big role to play there. We're doing right by people. When it comes to materiality and understanding what things are a risk to the organization, obviously safety and health has a big role there. We're hugely embedded in supply chain practices. We have a role in investor engagement, typically when something goes wrong nowadays. But I think increasingly we should be playing a role from a proactive point of view. And then, as we just saw reflected in the survey data, we play a big role in reporting, measurement, analytics, tracking, all those sorts of things. It's a bit of an admin role, but it's a role. And I think it's useful in terms of our positioning here. But what I would say is there are 5 more right under the waterline that I think if we position and talk about them right, they're a part and parcel of what we do. They're also part and parcel of the ESG and sustainability conversation. So fatality prevention, understanding human error and what makes people tick, physical well-being and fitness for work, mental health, stress, fatigue, psychological safety, DE&I, psychosocial risk factors, all of these things that are increasingly part of the safety and health discussion. And we'll talk a lot about them more here in the next few minutes. But I would really say that when we are able to find our footing on how we can describe safety and health's role in these issues and how they then reflect into the ESG and other conversations we're having at our organizations, our stock and our value and the way people think about us will change really rapidly. And it's not for that reason that we want to do this. It's not because we want to have more limelight in our organizations. I think some of us are probably hoping the limelight's coming off us post-COVID. But the point here is that if we lean in on these issues, we can add a lot. We can do a lot here that will impact people's lives, that will keep them safer, that will keep them healthier. And by not being able to articulate this sort of stuff, we're locking ourselves out of these conversations, and we're doing injustice by our stakeholders that we could be helping in our organizations. So really a lot of the drivers of this work over the past several years have been to better express and understand not just how we fit into ESG, but how we can bring ourselves as safety folks to these topics, how we can explore their connections, direct connections to safety and health, understand them better, and then reflect those out to everyone who cares about them. So, a nutshell of what work we've been trying to do from a research perspective over the past 2 years, and probably a lot of you are sitting here thinking, well, that's a huge topic to try to break down. And it is. And I think what we're going to share is really just the starting point of a much, much longer conversation and research work and work we need to do in the field. So, in terms of project scope, I think this next slide is pretty illustrative. This is where we are. I mean, we are at the tip of this iceberg in terms of how far we have to go on it. But unless we plant a flag here and say, hey, we know there's more beneath the surface, we have years of data that show this, we have years of activity and work that shows this, then we're going to be stuck on that iceberg, just sharing the few things, the few metrics that people have latched onto or care about, and the way we come at this is going to be limited, and our value is going to be limited. So really a challenge there. So, the scope here really for us was thinking about how we can move beyond this iceberg, right? And I've shared an old model of the accident cost iceberg or incident cost iceberg that probably everyone's seen some variation of before, to a more complex, more nuanced understanding of what is really under the hood for safety and health in our current day. And you don't really need to read all the boxes on this chart. It's kind of intended to be a little bit of an eye chart for you, but it's meant to say we have lots of different inputs in to how we create and value in our organizations. And unless you really start looking at that stuff in a more detailed and nuanced way, you're not going to get there. So the study was meant to take the thing on the right and really dig into it and look deeper at it. And not only that, it was meant to involve stakeholders and folks who are in this conversation far beyond those who we typically get involved. So, we wanted to make sure as we did this work that we were involving everyone from government and NGOs to investors to academics and researchers to ESG and sustainability professionals to ops and business leaders to insurance and investment stakeholders, and of course, health and safety folks. So lots of different stakeholders, lots of different issues we want to talk about, all of which needed to composite into a new model or framework or discussion of what the value of safety and the valuation in a dollars and cents or in a more material way actually is. And I know that, there's some scope creep here potentially, right? There's lots of issues here that on the face of them might not seem to have a direct connection to safety and health. And I think what we needed to determine was, do they, how do they, to what degree do they, where do we leverage these things to create value, create safety capacity, and where do we not? So that's really the intent of the study as a whole. Of course, like any good research organization, we started with a literature review. This is a very, I'd say, methodologically sound research approach that we took. And we were following on from some really great work that Lloyd's had previously funded by Delft University. You can go read that study around the valuation of safety and health and the value of safety globally. It's available on the Lloyd's website and on the Delft University website. Much more kind of, I'd say, the review of the academic literature. We wanted to go deeper than academic, or maybe different than academic, let me say, and look at the conversations that were taking place in the white literature, all the thought pieces, all the pseudo research, all of the frameworks and ratings that I shared. What's under the hood in those things? What do they care about? What are they driving folks to do? And really try to understand, as you can see here, the meaning and value of safety, what valuation and metrics were being used. How did they, if these frameworks and this work is expanding the box for safety, in what direction are they expanding it? What are they suggesting? And then what are the gaps in these different frameworks and surveys and studies? So we looked at a number of other pieces. And then another big piece of this is we threw that up against a review of over 80 frameworks that we looked at that looked at either EHS or ESG standards. So you can think of voluntary frameworks and standards, things like GRI, things like ISO, things like ANSI Z10, other frameworks and ratings that were out there in the safety space, as well as in the ESG space. And then we started to boil those down into the ones that were maybe slightly more practical, ones that had multiple dimensions that weren't intentionally kind of narrow. So if you look at, maybe ethisphere, they're very concerned with ethics. And of course, that's going to kind of limit what they tend to look at in that direction. So we wanted to look at those that were a little more expansive. But we also wanted to be practical and not try to boil the entire ocean. So we got down to 10 frameworks that we thought had the most breadth and represented the biggest use amongst a lot of organizations out there. And you can kind of see them represented here. A couple of different flavors of ISO in here. There's a few other pieces that we looked at. And we try to really composite those all together. The full study that we'll be releasing in a few weeks will have a huge amount of information on all of this. So I encourage you all to dig into it. But for today's purpose, without a huge amount of time, I don't want to get caught in the weeds of the frameworks analysis here, because there's lots more to share. But just wanted to demonstrate we have a pretty good depth there. And then we tried to track them against, where are things emerging? What are the themes that are coming out of these frameworks and all the literature we reviewed in terms of the expanded dimensions of safety and health in 2023? So, we looked at what you can see here is the darker green shading here demonstrates areas in which these frameworks or these things that we were looking at had a high focus. Sort of the medium green color is a medium focus and light green is a low focus, gray being no focus at all or no mention or little to no mention in the framework. So if you look at the 10 frameworks we looked at, you look at where they were placing their emphasis, we kind of naturally derived the things you see at the top there. focus on the issues, broadly speaking, of total worker health and ESG. And then within those buckets, subtopics like serious injury, illness, and fatality prevention, mental health, psychological safety, and psychosocial risk, diversity, equity, inclusion, kind of pure environmental and sustainability activity, and then ethics and governance. So, although those are kind of bucketed into 3 more total worker health leaning issues and 3 more ESG leaning issues, there's really, a lot of gray space in those topics, and things that are relevant on the ESG side are usually equally relevant on the total worker health side and vice versa. So it's not meant to be a hard and fast distinction in terms of where those topics fall, hence the kind of color gradation there. The other thing that we saw emerging and that we believe is a big part of this conversation is layering sort of the new view of safety, or safety 2, or the HOP conversation, human organizational conversation, over the top of these issues. So for those of you who aren't super familiar with HOP, it's really a way to look at human error and understanding how we truly build capacity and presence of defenses and safety in our organizations, so that when we fail, we can fail safely, and to look at human error as a design, not a bug, as a feature of humans. We're all built and hardwired for error and bias, and too often, as we've gone through our work in the safety and health practice over the decades, we've had an inclination to see workers at fault and blame and retrain and shame and fire and all those other sorts of things. So HOP is really about taking a new look at that from a maybe philosophical lens point of view. Of course, it comes with a lot of policy, procedure, and tool sort of implications that you need to build in once you get there. But if you look at what was emerging out of all the work we were doing, it suggested a framework that centered, or put a lens on things that maybe derived a slightly more nuanced version of what humans do, and then bucketed where people are placing their attention in terms of total worker health and ESG, and then what's under the hood of those things. So this was a map that got us to these topics. But we also went in and helped everyone understand, okay, here's what these frameworks were trying to tell us and why. Here's why they were going deep on these topics. Here's what they're asking you to do. Here's where they're strong. Here's where they may have some limitations in terms of what they're asking for, or maybe they don't give you any real indication of what you should do, right? Which is, I think, a big challenge out there with a lot of frameworks and advice that's there. Is it shows you what good looks like, but it doesn't show you how to get there. It doesn't give you any indication of what you should do first, second, third. That's the nature of a framework or a guidance document. So we have a lot of information in this report that we'll share that will help you make sense of all this, and maybe help you understand where your own conversations in your organization are. Are you placing bets on the total worker health side more so than the ESG side? Are your chips sort of across the table? Where do you stand currently in terms of how you're coming at this? And it may look exactly like the way the frameworks are. It may look totally different, but I think it's worth starting with here's where the external world is thinking. Here's where we are. How far apart are these things, and where are we on that curve? So that was some of the work that we did in the first year of the study to really kind of get our grounding and landing on where the world's been moving for ESG, for sustainability, for these other topics that are in the total worker health dimension. The bulk of the work was really after this, was to look at knowing that, where do we think safety and health has a material value in these conversations? Where do we currently play? Where can we do things for good? Where do we have limited ability to influence, or just not appropriate for us to get into those discussions? So we took a look at the the issues we were seeing, and you can kind of see some of those broken down into more kind of activity types. So if you thought about something like SIF activity, you'd have to think about it from a SIF prevention program. If you thought about psychosocial risk, you might have to think about mental health programs or EAPs or other things you were going to do. So we took it to an activity level. And then we thought about, if you had to think about categorization of what sort of value maybe we create in those spaces, could we understand what our primary value that we were offering was, and what our secondary and tertiary values we were creating was? Now, of course, our primary value in many of these, which is not even referenced here, is always going to be direct physical safety. So that's a given. And in the study, you'll kind of see, and I'll share some things here, that safety is always occupational safety and health, EHS, always at the center of this circle. That's our bread and butter. That's where we start from. But when we look at other dimensions we can offer, if we think about mental health, perhaps, we go in a health creation direction beyond a physical safety creation direction. If we think about fatigue management and really trying to prevent folks from having disruptions, operational disruptions, productivity disruptions as a result of rotations, changing job sequencing, other sorts of things, then maybe we're offering some economic value creation because there's going to be a more direct productivity gain on the back of having that working efficiently and safely. So that was some of the mapping we started to do. The value creation tags you see there, health, economic, environmental, et cetera, were really derived out of that Delft study. So they suggested these categorizations for the ways in which safety extends its value. And you'll see a little bit more about this as I go into some of the results here. But just wanted to share that those are not coming from nowhere. Those are actually part of the study we were tagging onto here. So we provide a map like this just to help you maybe think about doing something similar in your organization, of saying, where are we doing something that we're proud of or that we're going deep on? And where is that creating value beyond just physical safety? Because sometimes that's enough. I mean, it's not that it's not enough to just look at that, calculate that, and say, okay, we're good here. But I think we sometimes leave some things on the table that could help us really increase our impact and increase our value in our organization. So that's really what this is meant to share with you. If you go deeper into this, in the study, just to share, the depth of what we'll have in the final report for you, if you look at something like serious injury and illness and fatality prevention, if you look at a program like that, we've broken it down to, here's our primary value creation, here's the type of value, here's the rationale or the why behind it. So you can have a little bit of a narrative in terms of how these different activities actually increase value or affect value in your organization. And mostly this is to help you get a good grounding of what we mean when we're talking value creation. But it's also helpful when you're going to get that question from an executive or an investor or someone outside the organization, maybe someone even inside the organization who's going to say, well, why are we doing this? I get maybe that it's going to help us, keep somebody safe, but why are we investing so much time and effort in this? Why are we going to this level of detail? Here's some rationale for you. And so for each category, each type of activity, we have essentially a couple of pages that will really help you express that value, understand it a bit better. When you map that all together, that's kind of what we have here in the report. Is if you look at, HOP, we provide an overview of that and what that looks like, what that value creation is. Same with total worker health, same with ESG. And then, in each of the activity kind of buckets, whether it's SIF or mental health or anything else, we have some really detailed profiles on what those topics are, where safety and health plays, where our value creation opportunities are, and what we can be thinking about in terms of what we do going forward. So this is really a map of the structure of the report, if you like, to get you a better understanding of what's under the hood. I mentioned there's those detailed drill downs, so when you look at something like this, you can see we've defined what we mean by each of these different programs and practices. We've got the value creation there. We map it to where the frameworks talk about it. We suggest what sort of big initiatives or programs are in the mix of those different topics. And then we have some suggested or recommended KPIs and metrics that we've derived from practitioners, from the frameworks themselves, from our previous research work. So pretty comprehensive ability to go in and look at any of these different dimensions and say, okay, are we defining it the same way or have we defined it at all? Let's look at maybe where we can create some value here. We don't have any metrics. Let's think about these as a starting point. I'd never encourage anyone to blindly take metrics from a research report and use them. Definitely want to suggest that as you look at these are things to paste up on the wall for yourself as you have a discussion about what metrics you want to use and how you want to come at these. They're not meant to be prescriptive. They're meant to be a starting point for you to work from. And if you need any more metrics examples, we've got plenty of those. There's a lot of work we did in the Campbell Institute in the mid 2010s on leading indicators that map a huge taxonomy of different metrics you could go look at across many of these other categories as well. So feel free to dig into those at your leisure. So, I'll kind of take a pause here to say, this is, I think, an awful lot of conceptual work, a lot of framing, a lot of analysis and crosswalk of surveys, of data points, of frameworks. And I wanted to share, that when we got to this point to a degree, we had to take a step back and say, okay, if we share this with people, what are they actually going to say about it? Do they believe this makes sense? When we talk to practitioners, it's just going to look way too complex. Is it going to, just turn everybody off at the start? So part of the research work was to really go and have conversations with a number of safety and health professionals and leaders, a number of folks in investing, in insurance, in NGOs and governments. So all those stakeholders that I referenced earlier, we went and talked to them, we surveyed them. We also had qualitative, hands-on sort of focus group discussions with them. And we wanted to understand, where they saw it. So what you see here is just a few charts that I'll share on what our folks were saying on this as we were sort of midstream in the work. And this was a look at, how currently comprehensive the regulatory or standards coverage is in each of these spaces. So dark blue is extensive coverage. The kind of light blue is partial coverage. The kind of medium green, maybe tealish color is seafoam green, I don't know what you want to call that color, is it's only voluntary standards coverage. So you can go get it, but you have to really go to a non-compliance sort of perspective to go get coverage of those standards. And then, the light green is there's no guidance on this, and then the blue is I don't know. The point here is, I think that if you're now looking at this expanded set of dimensions of things that we have a role in, our core realm of occupational safety and health, pretty darn well covered in existing regulations and standards, although we know those are constantly in need of updating. Things like DE&I, discrimination, fairly well covered. And then as you go down to things like fatigue, financial health, mental health, AI, other issues that are emerging here, you get less and less and less coverage, and really demonstrates the need for something like we're providing to help organizations understand what is under the hood, what should you be talking about. So this was a good validation, I think, that there is a gap in this space and really where we want to go with it. We also asked them, well, where do you think we're going to see increased engagement in standard setting in these areas? So this is kind of the same question, and you can look at the spectrum there for color shading. That dark blue there's going to be way more regulation in this space. There's going to be partial regulation as your light blue. That green is a little bit static. Maybe they'll backslide, or they'll be developed for the first time. And essentially what you see is a very, I'd say, bullish prediction in terms of where we think standard setting is going to go. We think there's going to be, a bearish prediction, I should say. There's going to not be a huge, a lot of folks are predicting minor kind of changes to these standards. Some, climate change, you're seeing discrimination, DE&I, there'll be a lot of more increasingly stringent movement is what sort of our folks think. I guess what this is to say is that, there's a mixed bag here. Folks are seeing maybe minor tweaks coming. I think what we've realized is there's much more space here than just minor tweaks. In some spaces, we have no guidance in any of these areas. We haven't articulated how they fit into safety. There's a lot more need for someone to come in and say, here's what we think we should be doing, folks. Here's where we could go. If it's going to be developed for the first time, it'd be great if we could be involved in that development as safety and health folks who know these spaces fairly intimately. We know where we can provide value. We know where people can get hurt and killed in these activities. And then, one of the last things we asked a number of questions here, and we'll share a lot more in the full report, is, where do we see the real intersection point at the end of the day, ESG, safety, where do we think things are headed in terms of integration across the dimensions of environment and sustainability? So kind of the pure kind of aspects there, the social side, the DE&I side, and then kind of the reputation, perception kind of conversation. And I think what we were seeing is a fairly good perspective that there's going to be at least partial embedding of those issues with ESG and safety, and many thinking that there's going to be full embedding of those issues. So whether that means we're all going to be working for ESG leaders in the future, or whether those disciplines and domains are going to remain fairly separate, I think that there's going to be a need for increased ability to communicate, share, talk the same language, and really figure out how we can go into these topics together as partners. So, where that's all headed is the suggestion that we're making that, if you look at those different value drivers, health, economic, environment, sustainability, resilience, ethics, societal, reputational, we need to do some work in surfacing that iceberg. And what I'd say is right now, we tend to see things like health and economic value a little bit more present above the waterline. Those tend to be a little bit easier to put a dollar sign to, or to understand where safety and health fits in those conversations. As you go down that that pyramid there, you see probably harder and harder ways to have our voice there. So this work is meant to open that up and surface that and put the whole thing above the waterline and allow us to really build rather than try to look at just what's above the surface and say, we can build on this. This isn't a strict hierarchy. It's not to say you need to be able to explain your health value or talk about your health value before you talk about your economic value or your resilience value or anything else. But it's meant to say that safety and health has a role in each of these points on this pyramid. And whether it's a large one or a small one, we need to be able to talk about this entire pyramid or this entire iceberg, rather than just saying, yeah, we know we can see this part of it. We know we can't see that part of it. That's really not going to serve us well in these conversations that are going on the ESG front, on the investment front, on the social capital front, nowadays, because the language and the methodology, frankly, is a relic of the past. That accident iceberg, that's at least 40, 50 years old in terms of concept. And I don't think there have been any recent major studies on that in terms of actual evaluation in many years. And none of them have been looking at any of these issues beyond, what's in our four walls, what's within our span of control, what's in the gate line, right? So that's really, where we think we need to go. And the model that we've proposed at the end of the day, kind of sewing this all together, is a model that keeps EHS and safety and health in the primary focus, because that's what we do. The goal here is not to tell you go be an ESG professional, go become a mental health practitioner. It's to really focus us on safety and health, but to suggest that we need a lens that takes on the human, right, the human and organizational performance, the HOP perspective, and then that we have some rings around us that are areas where we create impact and create value, mostly tagged in the work that we're seeing in the total worker health direction or in an ESG direction, sometimes both. And then those topics around the edge, whether it's SIF or mental health, or you could put probably 3 or 4 others here. This is meant to provide a glimpse of a snapshot of what we think the world's thinking about right now. These are places where we can show value, we have impact every day, and we don't always do a great job of sharing it. And in part, that's because we don't have the time. In part, that's because we don't have the tools. In part, that's because we don't have a deep understanding of some of these issues sometimes. So again, all this work is meant to go from where should we be to share a model that maybe helps us understand and make it less complex, which is really what this is, to what I'm going to share, which is how do we do that, right? So that's really that's the sort of piece coming next year. But I wanted to share, this is sort of the upshot for y'all. If you wanted to take away one slide from this, I think you could do worse than saying, if you think about the value of safety and health today, we traditionally have thought about what's in that light blue bucket. That's all we've thought about in terms of our value creation for many, many years. And I would suggest that this whole circle is a place we can now play. We shouldn't get distracted and go run off into the edges of these necessarily, but we should think about our world as much more looking like this entire circle than we should just the blue circle in the middle. So easier said than done. I will say that much. It's very easy for me to say, hey, we've just done 2 years of research that tells you go do all this stuff. It's much, much harder to actually go out and start turning that wheel in your organization. So as I mentioned at the upfront of this, we weren't going to do this work unless we could provide organizations with a good understanding of what they should do and how they should do it at the end of the day. So to that end, we're preparing an activation guide with some case studies in it. Those case studies are going to come from some really great organizations that I can't share right now as we're getting ready to go, but we're very close to having this ready for you all. You're going to be very excited to see this, I think. But I'll start by just sharing, that we've generalized this to say, first, what sort of things do we think organizations should be doing? And not every stakeholder is going to be made equal here. We've got, I think probably today we're talking mostly to the business community, to safety and health folks. And you can see on the left side of this, what we think you all should be thinking about, right? Maturing your philosophy, operating philosophy in terms of HOP, maturing your metrics, integrating some of these issues and influencing folks. There's a totally different set of things, or a similar but different set of things we want people to do if they're in the financial or investment community. And likewise, if you're in the NGO space or you're those organizations who create those ratings and rankings, we want you to do some different things too. We want you to look at the metrics that we know are more material in terms of showing success or lack thereof, or capacity or lack thereof from a safety perspective. We want you to be engaging with us differently, et cetera. So lots of things we want to have happen out of this. I'll probably slide past this pretty quickly, but I would say, the research report will share, many recommendations and suggestions. But if you had to take away just 10, maybe screenshot this one and say, these are the 10 that we could go start from in terms of the business community, in terms of what we might want to look at from a new value of safety perspective, not just the things we've been going and doing, every single day. So I probably don't have the time to dig deep into these, and I've got several more slides to share with you. So I'll just say, let's put a pin in this one and say, I could do a whole nother webinar for y'all in the future on these 10. But how can we get there? What are we going to do? So we, alongside an executive summary, which is published today, you can go grab that. We'll include the link for you in our follow-up email. You'll get a 60-page version of that executive summary that will dig into all those issues. And then you'll get a really great guide that's going to bring this down to brass tacks, essentially. So in the activation guide, we take those dimensions that you've seen here a couple times before. We've taken a look at what impact gets created as a result of safety and health folks doing work in that space, right? Or anybody doing work in that space. And then what's the primary audience that cares about that impact, right? Is it business folks? Is it external folks? Is it the investment community? And we provided a sort of very sample, high-level version of what you need to do to understand that. You need your inputs, your activities, your outputs, your impacts. It's really just kind of logic modeling and mapping as a process. So this is a starting point. Then you look at that input, those activities, those outputs, et cetera. For us, the activities we're most interested in here are the EHS ones. What are the specific safety activities that are going to take place, that are going to have an impact here? And your input could be policies, training, research, all these other things. You see on the right some potential outcomes in terms of impact that are segmented as either social impact or financial impact, right? And tagged to the different stakeholders who might care about them. Generally, external stakeholders, NGOs, advocacy groups tend to care about societal value more than financial value. Business stakeholders, for obvious reasons, tend to care maybe a little bit more about financial value because that's their job and that's their primary duty every day. So we have this sort of more complex map. And then we brought it down into, okay, can we take the more specific activities? So you see on the left, actually some of the things that we think are being done. And we try to quantify where those outcomes are going to take place. They're going to be economic, they're going to be well-being oriented, or maybe they'll be more financial, kind of macro financial outcomes. Those are the three key areas where we think we can demonstrate material dollar and cents valuation. So beyond even just saying, hey, we think a safety activity here has an impact of some kind, qualitative, we'll talk about it in our annual report, we'll talk about it in our stakeholder conversations. Can we put a dollar and cents figure to it? So we've sort of drilled it down to just a few. And then this is a very sample case study here that you can see that we've started on, and it's anonymized for the moment, that looks at trying to take a company's data coming out of their supply chain in particular, and looking at, where did they create value through safety and health activity. In what dimension? Is it social? Is it business? Is it supplier? Is it cost avoidance? Is it direct? Is it well-being oriented? Where are the dollars being created or saved? And you can see, those start to add up pretty darn quickly when you start looking at things a little bit differently, and you expand the dimensions out to your entire supply chain or your entire organization, and you apply some of these metrics into the mix. You really begin to get a very different set of figures in terms of where our value creation is coming from and what it looks like. And we didn't just give you the sample, we're going to give you dozens of actual metrics and measurements and calculations you can go in and use in your organization. Maybe you only want to use one of them. Maybe you want to test it out and say, hey, this looks like a bunch of hocus. Let me take a look and see if this is going to give me anything useful. You can take them, plug them in. They're usually involved a pretty small amount of data internal to your organization. And we provide some sample benchmark metrics for some of the things that you could move one way or the other. So if you wanted to look at, improved quality of life, there's some really good benchmark data out there about what that looks like for a year of, continued life or a year of continued healthy life, et cetera. So we provide those metrics for you. So you don't need to try to figure those out. All you need to bring is your data from your organization, plug it in, get the calculation, and you're ready to go in terms of understanding, if you believe all this stuff about the value we create, then you can really go down to look at what the valuation of it is. And maybe you don't need to, maybe your organization buys it heart and soul and they're doing it for the right reason. But I think more often than not, we need some calculation, some ability to show the metric, particularly obviously when we're talking to the investment community who ultimately wants to do this to make better returns on their investment portfolio. So, we provide all this in the activation guide. It may be more than you want, but it may be something that really interests your data science and analytics people and the folks that work on your reporting, to provide them with new ways to think about and calculate all of this stuff. So we're really thrilled to be able to share all of this. What you'll kind of see coming from this will be, as I said, the executive summary today that you can go and grab. The full report coming in the next few weeks. We're in the design process on that, getting to look all spiffy, and you will, I think, love what you see when you take a look at that. And then right alongside that activation guide that will give you sort of the keys to this methodology. Going forward, we'd love to turn that into, online cost calculator, or a tool you could use to go do that very easily. We think there's lots of work to do to go deeper into these things and publish more examples, case studies, and in-field studies of how folks have used this. But what we're sort of suggesting is start taking these things and start thinking differently about the value and valuation of safety and health. Ultimately, that's what this is meant to achieve. I know there's lots of buzzwords in this presentation. There's lots of conversation about ESG. There's conversation about DE&I. There's things where you may be thinking, I hear those phrases. I still don't really know how safety and health connects to this stuff. The exec summary and certainly the full report will hopefully give you a wide array of ways to look at that, ways to see yourself in that, ways to understand where safety and health shows up on a daily basis in creating value and impacting all of these things. So that's kind of our intent here. And again, although this is just the starting point, it's a pretty complex starting point. So I appreciate everyone hanging in for the hour as I've walked through all this stuff. And I do have about 5 minutes here for questions. So that's really all the content I have today. I know it's been a lot of slides for you all, but hopefully there were some useful things in there for you. And I see we already have a couple of questions in, and I want to say thank you to Katie, who's provided the link to the Campbell Institute's research page. You can go and see a lot of great stuff in there. I referenced the leading indicator work, but there's also some really great stuff, including that very first publication on sustainability, which you could go grab. Kathy Seabrooks shares that it's an excellent report out. Thank you so much. Elaborating on the regulations regarding safety, risk, and climate change. Okay, good call. So that was a question we asked of the practitioner base. So we didn't actually in the research go to look at where those regulations are being developed or where they're going right now. But I can tell you that, for instance, we know that organizations in the US like OSHA are working on heat stress issues, which I see as sort of an applied version of climate change risk, perhaps, maybe a more practical and material version of that. But I think that, you might look to Europe and other places for how they're looking at that, and certainly doing a little bit more, or maybe a few years ahead of us in terms of where they're conceiving that and working on that versus where we are in the US. Not a value statement or a judgment statement, just kind of a reality. So I would say that the final report will provide details on current state. It won't necessarily provide where to go to see where the emerging work is happening in that particular space. But we can keep an eye out for that, and certainly happy to share that in the future. And I would say thank you to Leanne and Aaron for their notes of thanks there. So thank you all for that. Not sure if there was anyone else who had a question. We've got a couple minutes. If you're furiously typing away, I'll give you a moment to finish up a question there. But in the meantime, I'd say we do have the website available for you now, and if one of the team could drop that in the chat, I'd appreciate it, and we can direct you right there. But we will get you that in the follow-up. We'll also share the executive summary with you, so you don't have to go to go find it. We'll share the link directly to go grab that. And then if you are attending the BCSP Research and Innovation Summit in early August, or if I'm not familiar with that at all, I'd encourage you to go check that out. We'll be doing a workshop on Monday, August 7th that will dig into this and much, much more with a great panel externally, including folks like Kathy. So thanks, Kathy, for that. And of course, as we get along to fall and winter, other events that we'll be thinking about and sharing to go deeper on this and to help folks kind of workshop it and take it to a new level of activation. Seeing Kathy mentioned that they're working on this in the group that's working on revisions to ISO 45001. Someone relates to how fast I talk. Yeah, that's something I've had since birth. So it does help me when I need to get through 55 slides in an hour. But if you're just trying to track a conversation with me, sometimes I'm a little fast for folks. Josh was saying thanks and reacting to some of this work, moving in this direction and having some hard time getting traction, and letting people see the direction here. Totally agree. And really what this is meant to do for folks at the end of the day is, these are hard conversations to have. In some cases, they feel like sharp left turns. We've been talking about keeping people's arms and legs safe and making sure they're going home at the end of the day, safely and intact. But there's so much more. And I think we're all kind of scratching at little pieces of it in our organizations, depending on how long we've been on this journey. So this is a great way to composite it all together and maybe have some fuel for that conversation next time you have it. So, well, we're at 10 o'clock Central Time. So again, really appreciate everyone staying on for the hour. We will get some things out to y'all at the end of this and look forward to where we go from here. So thanks again, and we'll see you soon. Have a great morning.